Oral sex is use of any of your lips, mouth or tongue on your partner's private parts. So for men, it would be the penis, and for women, the vagina, and in some cases, the back passage, i.e. the anus. Oral sex has become fashionable, and you might hear the word used in other terms such as a blowjob, 69, or giving head. Oral sex on the vagina is called cunnilingus, and on the penis is called fellatio. So usually oral sex in most cases is done without protection, which means you're not practicing safe sex, so there is risk of sexually transmitted infections known as STIs or sexually transmitted diseases known as STDs. So some STIs include chlamydia, gonorrhea, syphillis, herpes and HPV, which cause genital warts. In addition, there is also a risk of cancer from high-risk HPV types that can cause penile cancer, vaginal cancer, cervical cancer and anal cancer, and cancers that can be transmitted from the genitals to the mouth, such as tonsil cancer and mouth cancer. Watch out for signs and symptoms of mouth cancer, such as mouth ulcers that do not heal after 3 weeks, red and white patches in your mucous membranes inside your cheeks, and pain on swallowing. Your risk of transmitting diseases from oral sex is increased if you have multiple partners, if you have any cuts or open wounds in your mouth, you are not using protection such as condoms or dental dams. A dental dam is a thin, flexible piece of latex that acts as a barrier between your mouth and your partner's vagina. If you have oral sex with a woman who is on her periods, then there is exposure to blood, and if you have a cut in your mouth or your lips, then you might not be aware that you are at increased risk of HIV. So if you are having oral sex and you are worried, then you can attend a sexual health clinic for STI screening and avoid any risks by practicing safe sex. Now, I hope you enjoyed this video. Please feel free to share, like and subscribe.